you need to have a great support system.
Mm,
Everyone needs to buy in to develop the sonographers. And
yes.
I think for us, one of the great contrasts to Echo School is that our facility has a vested interest in the
Mm.
success and development of the on-the-job trainees.
Cardiac sonographers play a key role in patient care, but like many other specialties, there is a shortage, and it is something that administrators are feeling as they try to fill these positions. So today, we'll be discussing the potential of on-the-job training to bridge that gap and whether or not it could actually alleviate the pressures brought on by this lack of healthcare talent. We're joined by Matthew Cox. He is the Technical Director and Educator of Adult Echocardiography at OSF HealthCare in Illinois. He is also an adjunct instructor in Echo at Eastern Iowa Community College. Matthew has over 9 years of experience in sonography and is a fellow of the American Society of Echocardiography. In addition to that, he holds an advanced cardiac sonographer certification, and he's one of about 400 sonographers that have that. So he's very qualified to speak to us today about sonography education. So thank you for being here today, Matthew.
And thank you for having me.
So a common theme, like we said in the beginning, and it's one that I've heard from imaging managers and administrators in general, is, we can't find enough sonographers. There's just more demand than there is supply. This, of course, transcends specialties. Today, we're talking about the shortage of cardiac sonographers, but there's a shortage of general sonographers, MFM sonographers. It's just really a common theme lately. And it really feels like, what could the solution be? Can we just like clone sonographers? Obviously, that's not something we could do. So, on the job training programs really do seem like a solution, but could you explain to us how viable they are in your eyes as an educator?
Yeah, sure. Thanks for the question. Just healthcare in general, we're seeing an immense shortage.
Mm,
Specifically for cardiac sonographers, though, I think the most recent numbers that I saw was that about 70% of labs nationwide are working understaffed. And our lab is part of that. And additionally, schools, at least in our area, are seeing a decrease in numbers as well.
mm,
And they're attributing that to the COVID-19 pandemic as well.
mm,
But fortunately, our credentialing bodies, Cardiovascular Credentialing International and American Registry for Diagnostic Medical Sonography, they have pathways to do on-the-job training. So CCI, they have two pathways for those individuals. Someone who is a graduate of a diploma, an associate's or a bachelor's health science. And that's going to include like cardiovascular technology,
mm.
ultrasound, rad tech, respiratory
Right.
therapy. And then they'll come to a program like ours where they then do 1 year of on-the-job training, and then they're able to sit for board exams. The other one is somebody who is already an active credential holder. So say maybe general ultrasound, they can come and do an accelerated pathway, which is only then 6 months of training with us, and then they're able to sit for the board exams. And I believe ARDMS is very similar in that they have two pathways for that as well. So you can have a single 2 year allied health degree like
Right.
physical therapy
Hmm.
assistant, rad tech, RN, and then you have that 1 year of on-the-job training. And then the other pathway would be anybody that has a bachelor's degree and then has that 1 year of on-the-job training. So you could, in essence, have a finance bachelor's degree and you could come and be a part of a program
Oh, wow. Yeah.
and sit for exams after 1 year of on-the-job training. And so, I think to answer your question, really, since we're seeing shortages in both schools and general applicants as well,
Mm,
we have found that we have a recruitment effort within our own organization. So we're
right.
finding qualified candidates in our own organization, those that have ties to the community, those that
Mm,
want to stay and work for our organization, because at the end of the day, this is a 1 year commitment, and so That takes a lot of time. It takes a lot of resources. And the last thing that you want to do is have someone train for an entire year, take their board exams, and then
Yeah,
leave and go somewhere else.
exactly. Yeah.
So what an opportunity that we have to provide a wonderful experience, to provide that
Mm.
training, so that when people become fully trained, they don't want to go anywhere else.
Right. And about how long in your program in particular, about how many hours a week of a commitment? Because you said about a year, maybe two, right? But then how many hours a week does that entail? Because the person is still working, they still have their other job, no?
So in this instance, it's a very good opportunity. They are getting paid while they're here with us, and
Okay.
so they're getting paid as an entry level sonographer,
Mm,
and so they are here 5 days a week, 8 hours a day, and it's all clinical based at
okay.
that point. So
Okay.
it's an amazing opportunity.
Oh, that's great. That makes it a lot more accessible, right?
Yes.
For sure. And I mean, it's internal within the organization. You kind of keep it within the same house, so to speak. So that's such an interesting idea, an interesting approach as well, just to meet that demand. Now, in your role at OSF, you're also an educator. And of course, I know you serve as an adjunct instructor in a school setting as well. But could you tell us a little more about your role in particular, especially maybe for sonographers who are interested in maybe educating? This is a topic that they like a lot. What role do ultrasound educators, especially in larger facilities like yours, what role do they play in paving that pathway to on-the-job training?
Yeah, I think educators, advanced cardiac sonographers, or even lead sonographers really act as a program director for Echo
Mm,
School in this role. The
right.
pathways is not only for large facilities too, but smaller medical centers as well.
Okay. Yeah.
We have a hospital in our ministry that only has about 3 or 4 sonographers in the lab, and they have taken on an on-the-job training aspect. And so I think, really, if you're a facility that wants to take on this task, your lead or your educator or advanced cardiac sonographer, the main person that's going to be doing all the teaching really needs to have a passion for the training and the
Right.
teaching.
Mm,
I think that, most educators like myself were echo nerds anyways. And so
mm,
I think utilizing that passion can really accelerate, your program and the healthcare system. I'll also utilize services of industry like clinical application specialists. They'll come in.
mm,
So whether it's for ultrasound equipment or ultrasound
mm,
enhancing agents, I'll have the industry people come in. They'll spend a day with our on-the-job trainees,
right.
go over machine functions. They'll go over proper indications to give ultrasound contrast. Um, and I'll go over that as well, but I think it's important that they hear from people in the industry too, and get that feedback.
Right.
At my facility, I kind of oversee all of the training and education the sonographers receive.
Okay.
Typically, that process starts off with 1 to 2 months of specific training by myself, really so
Okay.
that we can lay the groundwork and foundation for their knowledge. So that when we get to a point where we start mixing on-the-job trainees with staff sonographers, we transition into more of a refinement process as opposed to just, the building blocks of that knowledge and learning how to scan. And, one of the biggest things with that is effective communication. It's really
Mm,
key. One thing I learned early on in doing this is that you can't talk to everybody the same way.
yeah,
Not
for
everybody
sure.
learns the same way. And so you
Yeah.
have to meet the on-the-job trainee where they're at.
Mm,
Certain individuals excel under pressure. Certain individuals excel with very specific direction. And so even though you have a template or an outline that you've created, you have to modify it to the learning aptitude. And that can go both ways, where,
mm,
if someone excels, we move up the training plan.
right.
And if somebody may lag behind, okay, well, that's a good time for reflection. We look in the mirror, we ask ourselves, how can we get back on a path to success for that? And, I will say this program and process is anything but easy.
Right.
From personal experience, I'm an on-the-job trainee, and so
Mm.
I think you can really get a clear understanding, though, whether or not someone is going to be successful within a 3-month time frame. You can tell if passion, desire, understanding is there. Are they asking questions? Are they
Right.
engaging? Are they doing well on their pop quizzes?
Mm.
And so, and then that effective communication then is important when you start mixing them with staff sonographers as well. Having that constant feedback loop and communication with staff about progress and where the OJT is at, in
Mm.
that learning process.
Right. That's so interesting. I mean, it really requires you to turn into a teacher, right? The whole time,
Yeah,
I'm sure. Yeah, it requires a lot of that
absolutely.
ability and desire to teach and pass on your knowledge because you scan with them, right? I'm assuming you
Yes.
definitely are scanning with them. You're showing them. Yeah, yeah, yeah. Now, employer engagement itself, I'm sure, is key for this to work, right? Because the facility has to be on board. So, from your experience in the healthcare system you're in what ways can employers collaborate with organizations, for example, such as the ARDMS and CCI or others? Where is the room for collaboration to develop, sorry, effective on-the-job training programs?
Yeah, I'll say it's not so much the credentialing bodies that help develop a
Mm,
curriculum, it's the American Society of Echocardiography,
okay.
and utilizing their advice and their guidance.
Mm,
Um, what ARDMS and CCI will do, though, is they'll give you an outline or exam matrix for the content of their exams and
okay.
what they will cover.
Right.
And so from there, then you can formulate your lesson plans. But
Mm,
really, it's the American Society of Echo. Years ago, they put out an outline for there's a subcommittee, the Core Curriculum Task Force, and they put out lesson plans about doing kind of on-the-job training or education in general. And it pulled from really good textbooks from like
mm,
Catherine Otto and Harvey Feigenbaum and,
mm,
the stars of Echo.
right.
And everything that you need to know about Echo plus the ASE guidelines. And so when I was thinking about doing this program, I really found that the best way to do this is to have a textbook that then has additional workbook questions. And then from there, then you can kind of create a timeline to get someone up and running. Uh, and we try to do that as quick as possible. So, in about 6 months to complete that workbook, complete 1,000+ workbook questions. And that's really just what is completed outside of their work with us. While they're at the medical center, it's all hands-on, it's all clinical work. And so while they're here, they're learning how to scan, they're learning
Right.
how to be a team player. They're learning
Mm,
the real world application from then reading what's in the textbook. And so it's very important that sonographers understand where the on-the-job trainee is and in their timeline. So I will usually communicate verbally with the staff sonographer what we should specifically focus on their timeline. That way we don't get too far into other topics. And that way we can be on the same page and concise with our teaching. Uh, or the other way that I'll do this is we have a universal shared drive. And so I'll
mm,
put out all the information on that shared drive. And so everybody in our department can see that. And when it comes time for them to work with the on-the-job trainee, they know exactly what topics to cover and
okay.
what to
Mm,
exclude. So we're not getting too
right.
broad.
Right. Right. Now, you mentioned the American Society of Echocardiography, so I just wanted to follow up on that. Like, as an ultrasound educator, how important is it for you yourself to be involved? I mean, what's the benefit for you as an educator besides some of the stuff you just mentioned? How has that contributed to your role in a positive way?
Yeah, it's critical, I think.
Hmm.
Continuing education is something in healthcare that is absolutely necessary. I find that working with the ASE, having networking connections, asking
Hmm.
other people around the country, how does your lab work? What do
Right.
you do for policies?
Mm,
And, echocardiography in general, we're kind of a tight-knit community. And so
yeah,
you may ask somebody in California, what works well for them. And so that way you can really integrate all of the different things, find what works really well for you. But the ASE with their guidelines, with all of the physicians putting out YouTube content, putting out webinars, it's critical in making sure that you're compliant with Joint Commission and
right,
IAC
yeah.
and all of that too. And so I think it's absolutely critical that you are a part of an ultrasound society.
Yes, it's invaluable. This is something that I've heard from other sonographers, especially other educators, that their involvement and the networking is just so important for them to, stay ahead of the curve because it is progressing, it is changing, healthcare in general, but then especially sonography. You have a lot of new things that are being introduced, AI, of course, being a big one of them. So I'm sure that that is a
Right.
way for you to stay up to date. Yeah. Now, it all sounds very easy when you describe it, but I'm sure that it's not easy to implement these programs. So,
Yeah.
could you tell the viewers what some of the key challenges that you've encountered are and
Yeah.
what they could encounter?
Right. Yeah. So I would say kind of outside of the obvious, which is disruption to regular workflow,
Mm,
varying quality of mentorship, limited time for dedicated training, resistance from current staff sometimes,
right. Mm,
the need to be very effective in communication. Those are the obvious ones, but I think first and foremost, you need to make sure that this is something that is a good fit for your facility and
right.
for the person that you pick as the on-the-job trainee. So part of our interview process is that the candidates shadow for a full day. They'll see outpatients, they'll see inpatients, they'll
Mm,
see transesophageal echoes, stress echoes, and sometimes even
right.
procedures. And so it's a very challenging and rewarding career. And so they need to be fully aware and understand everything that involves the field and the career, because at the
Exactly.
end of the day, they're in this for an entire year before they can then sit for board exams and
Yeah.
basically staff on their own. So part of the training involves self-study at home in our
Mm,
program as well. And they need to be willing to study and they need to have self-discipline. So some of the characteristics that I look for is somebody who is coachable, someone
mm,
who is a self-starter, someone that doesn't need to be micromanaged.
mm,
Because if you're, at a point in your life where you can't commit to doing outside of the 8 hours here at the medical center, chances are that you will not be that successful because
yeah.
this you have to do a lot of self-study outside of your work here. So, but I think another challenge could be that if you're at a smaller facility with limited resources, you may not be exposed to a wide range of pathology,
Mm,
and so for on-the-job trainees to see that pathology and to learn and interrogate that firsthand, that can have an impact, especially come time to take your adult echo board exams,
right.
because the adult echo content outline for ARDMS, I think it's about 46% of the exam is on pathology. So if you're at a facility where you're not exposed to a lot of that, that can be critical come time to take your exam.
Mm, yeah.
And so I guess some advice I would have for other facilities, if you're at a smaller place and you want to do this, I would now start creating an electronic log of all the interesting cases that come through. That way, then when you have an on-the-job trainee, you can go through that electronic log and see all of that pathology. You can use that as an education tool,
Right.
and then from there, you can generate mock competencies and go over protocols for disease processes. And I think, maybe the final challenge uh, that I'm thinking of would be that you need to have a great support system.
Mm,
Everyone needs to buy in to develop the sonographers. And I
yes.
think, I think for us, one of the great contrasts to Echo School is that our facility has a vested interest in the
Mm,
success and development of the on-the-job trainees, whereas potentially sometimes when schools send sonographers to clinical sites, they are at the mercy of the clinical site.
Right.
And when you go to these places, sometimes, not everyone wants to train.
Yeah.
Some don't care about developing
Mm.
sonographers because it may not directly benefit them. Some sites may have just overall grumpy staff.
Yeah.
Some may not see a lot of pathology, uh,
Yeah.
and some may be just so short-staffed that they simply don't have time to
Mm.
train. And so having an echo lab where everyone sees the benefit in training, that can provide a great learning experience all the way around.
Right. So the big theme is you gotta want it, basically.
You
It's
have to
not
want it,
easy,
yes.
you have to want it. Because yeah, it's hard. It's hard to do. And what you say is very true, that that is a benefit, right, of a on-the-job training in a facility that cares, because that is something I've seen before. Not that schools, of course, are bad, but sometimes
Correct.
the places where you do your rotation or your field work, whatever the program calls it, they might agree to have you there, but they might not the staff might not totally want you there.
Yeah,
It's
exactly.
kind of hit or miss, and that's tough as a student, right? As someone who's trying to, you really want to get to do it. But then there's great places, of course. So it depends. But that is a really key point that you say there. For the benefit for the person who wants to become a sonographer, right? If they're in the right place. Yeah.
Correct. Yeah.
Yeah. Now, from your firsthand experience as an educator, as someone who's created one of these programs, what positive outcomes have you witnessed thus far?
Yeah, I think one positive is that every on-the-job training that we've had, they actually have been up and running faster than schools can prepare them. In some cases, we have on-the-job trainees running a full schedule by themselves with staff supervision in about 7 to 8 months. Whereas
Wow.
some
Yeah.
schools, they can last up to 2 years. And
Right.
based off of several factors, they may need additional training once they arrive on site.
Yeah.
And so there can be a quicker benefit to handle that volume at your medical center. Um, I think, additionally, it's just overall personal advancement for on-the-job trainees. Generally, and this is true for me, I came from a less rewarding career with lower pay,
Mm.
and now I've obtained, a better sense of making a difference in the care that
Right.
I'm providing my patients. I think uh, this also leads to retention of staff as well. So once on-the-job trainees start working with a group of sonographers that are warm, they're welcoming, they're willing to give of their time and help in any way possible, I think that plays a role in the success. And their eagerness to stay and thrive in an environment like that is, it is kind of rare sometimes. Um, and then I think maybe finally, everyone trains, it's not just me. So this allows for self-study for staff sonographers as
Mm.
well, too. So I think staff sonographers need to stay sharp because if the on-the-job trainee has questions, you need to be able to answer those.
Exactly.
And you know, even if you don't have the answer right away, if you go to the internet and you look things up, you may have known it at one point in time, but now you're relearning it and you can
Yeah.
take that with you, for future exams. And I think that really allows for practical application of knowledge. And so you're taking that textbook that you have read, and then you're then applying it in a real world setting. And I think through this process, I think that fosters a more capable and adaptive team by doing that.
Right. So in the end, it's a value not just to the student, but also to the teacher, to the
Yes,
sonographer that's teaching. Absolutely. And of course, to the facility as well, right? Because I'm sure that you guys have had great talent come out of that program. Well, Matthew, thank you again for sharing your insights with us. I mean, this is a topic that we definitely have to talk about more. And I think
yes,
that the expertise that you shared can definitely be insightful to other educators, other managers, or just people who are looking to implement these programs, and even maybe those who are interested in sonography that think they have to go to a school. Maybe they can find a facility like yours that offers that. So thank you very much again.
and thank you.